I am Dr. G.S. Gupta, a senior consultant physician with a special training and expertise in treatment of diabetes and heart related disorders. Today I am going to talk about cholesterol and the importance of cholesterol in relation to diseases. Cholesterol, as we know, is in layman's term called as the charbie in blood. Now, what do we mean by charbie in blood? In fact, this cholesterol is of many types, and if we analyze the different types of cholesterol, they are: number one, the LDL cholesterol, the HDL cholesterol, the VLDL cholesterol, and the intermediate cholesterol. These different types of cholesterols are something in layman's terms different, and they can be given analogy to the different types of fat we consume in our diet. For example, we consume desi ghee, we consume refined oil, we consume olive oil, we consume mustard oil, and so on. Similarly, the nature has made cholesterol of different types in human blood. This cholesterol in blood is especially important because this is the main cause of heart related diseases, especially the blockage of the arteries pertaining to heart or brain or any other organ in the body. The bad cholesterol, which is called LDL cholesterol, is the most important cholesterol which causes diseases. In fact, if we talk about all heart related attacks, the heart attacks are usually because of the blockage of the arteries, and the most important cause of the blockage of the arteries is the LDL cholesterol, that is the bad cholesterol. Going further, we can say the LDL cholesterol is of many types, and then one type, which is the small dense LDL particle, they are the cause for blockage of the arteries. Now, how does that happen? The LDL cholesterol has the property of atherogenicity, that is, it causes blockage of the arteries by adhering to the internal surface of the arteries. The LDL which is present in the blood, that gets oxidized and that sticks to the internal layer of the artery, and on top of that we find the deposition of calcium or other material like platelets. Once a platelet sticks to this, then this becomes very thrombogenic, or a clot forming process can start. So one has to take care of the LDL cholesterol if one has to avoid the development of blockage of the arteries. What are the ways by which one can decrease LDL cholesterol? There are important ways and means. The most important, of course, is the dietary restriction, in which we say the restriction of saturated fat, that is the desi ghee. Once we talk of desi ghee, it means the desi ghee as such, be it butter, be it cream, or any other form of saturated fat which is present in milk or milk products. For that matter, even other oils which are not derived from milk, for example coconut oil or certain other oils which are not much in use, can also cause atherosclerosis or blockage of the arteries. So all these oils are harmful, and the oils which can decrease and can be beneficial for the health of the arteries can be olive oil, mustard oil, or one or two types of refined oil. Majority of refined oils have not been found to be good in the long run, but 2-3 types of refined oils can be used, and that we have the rice bran oil, the soybean oil, and the canola oil. Other refined oils have to be discarded. If we talk of refined oil as a whole and talk of health in general, then refined oils definitely take a back seat in comparison to olive oil and mustard oil. Olive oil always remains on the top if one has to decrease the blockage of the arteries, if one has to decrease the LDL or the bad cholesterol, and that is the most important aspect of dietary restriction. Other things we can do for lowering LDL cholesterol in our blood is use of lot of fruit, vegetables and vegetable products. In fact, there is no vegetable, no fruit and no dry fruit which will increase your bad cholesterol. It is a myth in many patients that they think that taking of dry fruits will increase bad cholesterol. Dry fruit don't contain any bad cholesterol, so there is no question of increasing bad cholesterol by intake of any dry fruit or vegetables. So these things can be taken in plenty, and taking lot of vegetables and fruit in fact may decrease bad cholesterol to some extent. After dietary restriction, the next thing which can lower the bad cholesterol would be exercise. It's important that the exercise should be of aerobic type and it should be on regular basis. It's not that just doing exercise for 5 times a month or 20 times a month is enough. More regular is the exercise, more are the benefits. Apart from decreasing the bad cholesterol, the exercise will also offer the benefit of increasing the speed of circulation and decreasing the circulation time, what we call, and decreasing the coagulability or the stickiness of blood and increasing the blood flow to the various parts of the body including the heart. So exercise is important in reducing LDL cholesterol or the bad cholesterol and also for the preventing the blockage of the arteries. Now I have talked about the bad cholesterol, the two ways by which we can decrease it. Now the next thing which is important is the medication. Over the last 3 decades, now it has been well established that certain drugs, what we call as statins, are of paramount importance for not only lowering bad cholesterol, that is the LDL cholesterol, but also preventing heart attacks and preventing the blockage of arteries, be it in the brain or in the peripheral arteries or any part of the circulation. Because statins not only lower the bad cholesterol, the LDL cholesterol, but also decrease the amount of deposit of cholesterol in the arteries. Given over a period of months and years, the statins have the property of decreasing not only the LDL cholesterol or the bad cholesterol from the circulation, but also they decrease the amount of cholesterol deposited in the arteries in the inner layer. Of course, whatever deposit has occurred because of the hardening of the arteries or because of the calcium deposit may not be reversed, but what we call as a atherogenic or a labile plaque or a labile fat deposit or a labile streak we call in scientific terms would be stabilized by the use of a statin. So statins are very important. No amount of emphasis is enough to state that statins have saved hundreds of billions of lives over the last 30 years. The first statin to be launched was atorvastatin in clinical practice, but before that we had other statins, but for clinical practice in wide use had been atorvastatin. And the results over the last 3 decades have shown that statins not only lower the bad cholesterol to great extent, but also prevent the blockage of the arteries, reverse the blockage to some extent and prevent heart attacks. So that is about the statins. There is another newer group of medications available to reduce the bad cholesterol, the LDL cholesterol, and that is what we call in short as Pcsk9 inhibitors. Now these are a novel type of molecules which are basically directed against a particular antibody in the liver where this bad cholesterol is manufactured. Suffice it will be to say that they are available in injection form and they have to be administered only once in a month. However, at present their cost is exorbitant and majority of patients feel the pinch of the cost. Moreover, they are not required in majority of the patients even if they are already having the blockage of the artery or even if they are having very high level of bad cholesterol. Coming next to the cholesterol is good cholesterol, and the only good cholesterol we have in our blood is what we call HDL cholesterol, or the high density lipoprotein cholesterol. In fact, nature has given us this good cholesterol in order to reverse the blockage of the arteries because of the fat deposits. But unfortunately, this LDL cholesterol levels found in the human bloods are quite low. In fact, it has been seen in many studies that people who have very high levels of HDL cholesterol usually are free from heart attacks or blockage of the arteries. But in Indian patients in particular, it has been found that they have very low level of good cholesterol, that is the HDL cholesterol. HDL cholesterol is difficult to increase, and in majority of persons it is low because of the genetic predisposition. That is, it is low because of the genetic inheritance. Of course, in some European people this may be high, but taking in consideration both HDL and LDL is important, because if HDL is good and LDL is very high, then bad takes over the good and the person is going to develop the blockage of the artery. So one has to reduce the bad at all cost and try to increase the good at all costs, whatever is possible. For increasing the good cholesterol, there are only few things we can do, and one is, which is very important and not known to majority of people, is to decrease the intake of refined sugar, because more the refined sugars we eat, less will be the good cholesterol. So avoiding refined sugars is important if we want to increase your good cholesterol. Second thing which can increase your good cholesterol is regular exercise. Third thing which can increase your good cholesterol or HDL cholesterol is only few medication, and that we have a dietary supplement called as resveratrol. However, majority of our food items don't contain any amount of resveratrol. Only few fruit contain resveratrol, and in that we have the red grapes and the blueberries or the blackberries, which contain resveratrol to good amount. None of the other fruit, vegetables or the meals we eat contain resveratrol, and that's why we cannot increase our good cholesterol to any significant level. Putting everything together, LDL is the most important thing if we think about the blockage of the arteries, and if one has to prevent the heart attacks, the paralytic attacks because of the blockage, one has to lower the cholesterol, especially the LDL cholesterol, to the maximum if we have to prevent these diseases. I think that should be enough for today. We can talk about cholesterol something next time.